Brothers and sisters, leadership that we are given in the union is not to rule, is not to govern, is not to exercise power. But what you have bestowed upon us today, which we take with utmost humility, is to serve you and to offer service. There is a trust that we have taken that each and every leader that is here today that has been elected, that today you saw it unanimously ratify outside there to represent you when they meet chief officers, to represent you when they meet governors, to represent you when they go to State House, or to represent you when you meet the ministers. So that is the role. That as Dabji, Atela alone, I'm different. But as SG in any capacity, as chair in any capacity, when I speak to any of the authorities, I speak knowing very well that there are 10,000 doctors that I represent for the issues that need to be discussed. And from our oath today, which has been taken by each of us, the last thing that we will want to do, and I know we can never do, is to not comply with that oath, is to go against the Constitution of the Union, is to go to any place and speak for ourselves, not for the membership that have elected us. That is a trust that I can attest to you, and I think based on the regime of 2021, 2025, 2026, you can all attest that there were doubts probably before. There were thoughts in our ADC, which we have here on 30th of November 2024, because interns had been paid 70,000, because doctors had not seen arrears that time, because many of the issues that we had gone on strike for had not been implemented. And I remember when many of the concerns were raised, whether a few of the leaders were given bribes or whether they had taken money into actions, we expressed that yes, money was offered, and they're not offered in the minute forms that we were thinking. They're not offered in forms of 6 million or 10 million, but they're offered in big amounts. But I can tell you that it's out of the trust, the sacrifice, and the belief and the conviction we have. None of the leaders dared think about taking any bribes at that time. And when we left here with the resolution in this same place in 2024, it took only 3 weeks to have the interns across the entire country to be paid back their arrears at 206,000 that have been deducted by government. It is out of this resolution in this same ADC that took place in this same venue that the government released money in 2 tranches, the 1.75 billion that was paid in December 2024, another batch that was paid in September 2024. That's why we are here today, that there's some value and conviction when we come to Safari Park. Because the resolutions we make here are made in the city where there's treasury. They're made in the city. They don't need to take a plane from Mombasa to Nairobi. Because when we went to Mombasa last year, when we came back, I have not seen anything great though in terms of all the doctors. Because in that ADC of Mombasa, what we had is that we had the current lot of interns who were firstly posted again without having to pay, having to go on the streets. So if I look at it critically, clearly, that our ADCs have had impacts. The ADC of 2024 here gave us impact. The ADC of Mombasa of 2025, where we invited the Ministry of Health, and it was the ADC where government were again going against the agreement, where they wanted again to go back to 70,000. We invited the new minister in that ADC, and he reaffirmed that year, 2025, they'll post interns at the full salary.
And indeed, the interns were posted at full salary without any demonstration for the first time, I think, in almost 15 years. That interns did not have to go on the street. And the month of July, they got their wages. It was the same year that we got our second batch of the arrears. But now, in the same breath, we've been following those other arrears that were remaining.
Particularly the 2024-2025, the adjustment of the basic salary implementation and negotiation of the new CBA. Those are things that we've been following. But as we all know, it is almost an impossibility. I know Dr. Miskela expressed it during the campaigns, but the reality is you have to be fully in the office, fully anchored, fully supported to be able to actually offer the services. So yes, we had promised that these were to be done between the month of March, April, and May. But as you all know, during that time, we were all looking for votes across the country. It doesn't mean that we were not acting. But during those particular moments, we sent different letters to the government. It's only that at that particular point of electioneering, it was impossible to take actions. And that's why, to us as a leadership, to us as a membership, we believe that today we must make a definite decision on key issues that we believe are going to see another result in the wave of results we've seen after the 2024 ADC, after 2025 ADC. So we expect much better outcomes after this particular ADC. I'm saying that because I believe that our solidarity has demonstrated that there's nothing impossible. If government will pay us our 70 years debts, then we can get the 30% salary increase that we will be demanding today. If government will pause the interns after trying to reduce their salaries, we can get automatic employment of doctors every year from this ADC. If government can manage to do an emergency fund and ensure that the postgraduate fees for doctors are paid from 2021 to 2026, it is possible to have doctors who are serving in each and every county have a medical insurance that is deserving. That we don't have to do contributions the way we were doing in Trans Nzoia, where even the governor of that county actually was contributing with us. And that was because the doctor was in the hospital and she could not get the services that ourselves has been offering. So those are the realities. And we must also be very clear. And I know, and I was at the Labor Day celebration, and I am happy that some of the hurdles that we've had in 2021, 2022, 23, up to 2025, where the Salary and Remuneration Commission was very clear that there will be no salary increment for any CBAs. It made the teachers to have a CBA which had zero money. It made negotiations very difficult. We had an agreement with KNH where we had about 20% salary increase in 2023, but SRC decided not to approve. We have negotiated with Kenyatta University Teaching and Referral Hospital, and we have the roadblock of SRC. And that has been said, it was because of the economy was not doing well. That has been the story. But during the Labor Day of this year, on 1st of May, I was at Vihiga, where the president said, and I want to quote, that there's general wage increments of workers at 12%. And there's wage increment for agricultural workers, 15%. First of all, we are agricultural workers. You must be aware of that. So the minimum wage increment that was done, general one, was for all other workers, 12%, and then for the agricultural workers, 15%. What that means is the stories that SRC has been giving us all through can now not be part of the negotiations on the table. And therefore, our demand that we are going to table to the government of 30% increment is nothing high. Because the last time, as much as we've been getting arrears, the last time we actually got a salary increment as doctors was in 2017. That means the inflation for that period has been very high. So one of the things that we have put in the 2025-2029 CBA is that the salary increment generally, for all the doctors from interns to consultants should be 30%. Because the people who are doing agriculture, which we are also people of agriculture, I think you know that, and we make sure that those who are agriculturalists are healthy. That's why we came with a figure of 30%. And that is after all the parameters of the inflations have been included. So one key thing that we must come out with here, that we must ensure is done, and I think Chair will read that, within 90 days in salary increment. Comrades, I know for sure that we've been having one of the best ministers on Aden Duale. I am not saying this with any fear of contradiction. I am saying this because of the engagements we've had with him since he was appointed on 4th of April 2025. That he has had an open door approach on the matters pertaining to the issues that we presented. But there are some things that are pending. There are some things that need to be resolved. And that's why we had invited him here to be our chief guest, so that he will give us the solution to these matters in the same manner he did in 2025, ADC in Mombasa. He was to come until, I think, 2 days ago, when he was appointed to represent the president in Djibouti swearing in. Dr. Luga was then to come on his behalf today, but him also he has been tasked to go to a function with the president in Maseno. And therefore, I just want to present what I had presented to the minister. I want to present to you what we discussed with the junior doctors yesterday with Dr. Luga at Golden Looks at night. I want to just tell you what we wrote to the Deputy President, to the Head of Public Service, to the Council of Governors on 30th of April 2026. Number one, we reminded the government that the Ministry of Health doctors have not been paid their 7 years arrears as per our agreement that was deposited in court on 8th of May 2024. And we told them this has to be paid urgently within 21 days. We told the government that 1.75 billion that was promised on 19th of December 2024 in a meeting with the Deputy President was in the supplementary budget of this year, but then was removed because there were emergencies of drought and other things. So we said this money must be paid within 90 days. We also wrote to the minister and to the Council of Governors that they are in violation of a court order that ordered for employment of 2,000 doctors, and that also indicated that they'll be employing doctors every year. That we want these actions immediately, because in the wordings of the return to work formula, this was to be factored in 2025-2026 budget that is ending in June. We also expressed our displeasure with the medical insurances that we are having and the inability of doctors across the country to access the care. So these are things that we wrote to the government on 30th and indicated that we are going to take resolutions in this meeting today. And I know the chair will take that resolution, but I'm here to implore upon you that as Davji, whom you've just re-elected and sworn in today, Mwachi and the branch officials, there's nothing we can do without the solidarity that is necessary. And our solidarities can be expressed in many ways. And one of the many ways is to cite the government for contempt on the things they have not done. It's also possible to invoke Article 41 of the Constitution to tell the government that if these things are not done, then we proceed on industrial action. So while Chair will be putting it in our resolution to discuss, I want to implore upon you that if we come to you to ask for the industrial action, for the strike, to get the new CBA at 30%, and to get all these things fast-tracked, kindly pass it. Because by passing those resolutions, you can be very sure that we will not go for Christmas in 2026 without a new CBA. That all the things that I've mentioned here that are pending will actually be actualized and will be seen. Because we have a memory and we have an history as a union that everything we discuss with members in this forum are actually implemented and members see results in those things. So that's one of the things that I am asking upon you and all of us, that we go and discuss. But you must also remember, when you're going down back to the counties, that we always say we start mobilizing early. And I'm saying mobilizing early. Otherwise, and this is very honest with you, that if the minister was not the minister we have today, we will have left you with a strike notice. But because he's the minister, Duale, who we talked to on phone, and his friend also, Dr. Miskela, and all of us, we are going with a resolution that if it is not done in 90 days, we will take action. And the same must go to the Treasury and to the public service management. Because one of the other things that we have faced is either incompetency or lack of goodwill or inability to handle the IPPD code. We have followed the IPPD code with the Department of Public Service for the last 1 year. Counties wrote to IPPD that they have money from the equitable share in the budget of 2025-2026 to pay us or to increase the money in our pay slips. But that public service ministry has been dilly-dallying with this. Until now, we are risking losing that money by June this year. So when we are giving this demand that that money has to be released latest by June, it means the counties may decide to reallocate this money to other activities. And therefore, we will be fighting for another 3.5 billion. So the reality is our ultimatum that yes, while we negotiate the new CBA, while we agree on these other matters that are pending, the matter of our money that is already with counties must be paid. And it must be paid in arrears from July 2017, when counties indicated that they have the money. And such times, when somebody is robbing you your money, you don't need to think so much about action, brothers and sisters. When we engage the county this month, and we see dalili, or we see any intention that that money is not going to come to us in June, and we have to fight for it in another financial year, I want to tell you that one requires a 7-day notice. Because once that money which is in the counties goes away, it will take another stronger effort to do it. So our action is, and our request is, we may negotiate on all those other things within the 90 days that chairman will present, but on the issue of adjustment of our pay slip, that is already decided, that money is already there, we should not compromise on it. And that is one of the takeaways that we must have from here, that we are demanding that money to be released immediately because counties have it. I want to finalize by saying that the leadership that have been elected this year, that have been sworn in today, that went out asking for votes, were inducted to office yesterday. And one training that we had and that we believe in is that there has to be membership engagement from the hospitals. There'll be county kamkunjis, there'll be press briefings in the branches, in the counties. And I want to implore upon you, doctors, that when you ask for actions, when you ask for engagement in those hospitals, in the branches, in the counties, please turn up. Because the issues that we want for this year, 2026, 2021, are issues that we can only get when we stay united. We must discern and know that the distractions may come from different ways. But our focus should always be on the price. Our focus should always be on the result. We have achieved results over the last 5 years. We are starting this term with results. And we want to see the results that are there from the ground, from the counties, from the facilities to the national. We want to see to it that doctors are not quiet when they're being frustrated by administrators in the counties. That we are able to report to the branch secretaries, to the liaisons, that our lawyer, who in the last 5 years won 222 cases, 220 cases out of 222, we'll be able to win 100% in this particular dispensation. So I ask all of you, let's rally up to support the leadership, let's rally up to support ourselves, and let's know that all the resolutions that we'll pass here today are for the things that are going to benefit each one of us. They are not political promises that we always see on the streets, but these are tangible actions that we all must come out strongly defend and demand from our employers. Thank you.